Good afternoon, and thank you for joining us for this community briefing on COVID-19. Joining us once again is interpreter Margie Prop, and thank you, Margie, for providing your services to make this briefing more accessible to all in our community. Before we begin our discussion of the latest COVID-19 data, we once again want to let Lincoln Police investigator Mario Herrera and his family know that our hearts are with him as they seek to heal from the wounds of Wednesday's shooting. We want to thank our community for the outpouring of support and love they have shown in response to this tragic event. It was reported today that in the span of 90 minutes after Chief Blymeister asked Lincolnites to donate more blood yesterday, that the blood bank received 136 donations and over 130 appointments were made. I have a little update on those numbers. In the last 2 days, over 400 units of blood have been donated, and now 300 blood donation appointments have been scheduled so far through this week. And we are just overcome with gratitude, and we want to thank all of you who stepped up in response to what happened to Investigator Herrera. As we work to protect the health and safety of all of our community members during this pandemic, we want to remind everyone that you may access the latest information and data at our website at covid19.lincoln.ne.gov. That's where you'll find our dashboard with the latest COVID-19 data and information, and we update that dashboard at about this time daily. At the website, you'll also find our COVID-19 risk dial, a color-coded tool that communicates the level of risk of spread of COVID-19 in Lincoln and Lancaster County. We update the dial every Friday. And this week, we are moving from the upper yellow section back to low orange. This means that the risk of the virus spreading in Lincoln and Lancaster County has now moved from moderate to high risk. As we have seen our indicators take a step back this week, we have also suffered another loss. We lost another member of our community to COVID-19, 60-year-old Kevin Hopper, who was a University of Nebraska employee for more than 40 years. That brings the total number of community members who have passed away from this virus to 20. And on behalf of the City of Lincoln, I express our condolences to his family members, his friends and loved ones, and to all of those who have suffered losses during this pandemic. Today, an additional 73 individuals in Lincoln and Lancaster County have tested positive for COVID-19. The total number of lab-confirmed cases now stands at 3,875. Our total recoveries identified to date are up from 1,799 to 1,820. Health Director Pat Lopez is here to provide more information about our increasing caseload, as well as an analysis of the indicators that determine the position of our risk dial. Over to you, Pat.
Thank you, Mayor. The Health Department uses 3 weeks of data, as we've said before, and 5 primary areas to determine the risk of COVID-19 transmission to the public. After experiencing 3 weeks of improving data, however, we are seeing regression in a few areas. One of those is the number of weekly cases. After 3 consecutive weeks of declines, we went from 153 cases the week ending August 15th to 171 cases the week ending August 22nd. And so far this week, we are at 251 cases, which is a 47% increase over last week. You'll remember that after Lancaster County moved to Phase 3 on June 22nd, we began to see an increase in the cases due to more activity in the community. Data is showing that our recent increase in new cases is due to increased activity with students returning to schools, colleges, and universities. Specifically, we are seeing increases in individuals between the ages of 11 and 29. In the week ending August 15th, 37% of the new cases were in the 11 to 29 age group. This past week ending August 22nd, the percentage of new cases in that age group jumped to 62%. For the week ending August 22nd, we saw 36 new cases in UNL students. So far this week, 114 of this week's 251 new cases are related to UNL, which is a 45% of the week's new cases. We believe some of the students were already positive for COVID-19 before they arrived on campus. At this point, our contact tracing and investigation have not confirmed any in-school transmission at the K-12 level. We also have not confirmed any transmission in any of the classroom settings on college campuses. It is truly the activities that students and their families participate in outside of the school setting that are contributing to the increase in new cases. We're talking about people gathering socially while not wearing face coverings and not observing physical distancing. We are also seeing cases on sports teams and in college students who are going to parties and bars without taking the same precautions. We are seeing cases in shared living spaces like dorms, sororities, and fraternities, as well as apartments. We are grateful for the sororities that have shown leadership in getting tested and quarantining. These are the actions that will help us succeed in containing the spread of the virus. What this data tells us is that our educational institutions are doing a great job with the prevention strategies that they have implemented in the classroom settings. Their prevention efforts are similar to all of the mitigation efforts that have been implemented by our businesses and large work sites. The bottom line is we are not finding large clusters of cases from exposure in classrooms and in the workplace. We are finding transmission with all the activities outside of school and work. The weekly positivity rate had also dropped for 3 weeks in a row until last week. We went from a weekly rate of 5.4% the week ending August 15th to 6.7% the week ending August 22nd. So far this week, we are at 10.1%. This increase in the positivity rate is largely a reflection of who is being tested. Over 1,000 college students have been tested over the past 10 days. We know that college students are more socially active and therefore at higher risk of contracting the virus than the general population. So when the higher risk population is being tested, we expect to see a higher positivity rate. Testing remains widely available in the community. However, we continue to see a decline in our weekly testing numbers. Despite an increase in testing in students, we are down from 4,300 tests the week ending August 1st to just over 2,500 tests this past week ending August 22nd. So far this week, just over 2,500 people have been tested. We do anticipate additional testing being done due to schools and colleges being in session. The University of Nebraska is doing their testing at the health center on campus, and they have plans to expand additional on-campus testing opportunities with Test Nebraska as well, which has been implemented. Other local colleges like Wesleyan are also implementing plans to expand testing for students. We did have some recent delays in reporting test results, but the delays did not have anything to do with the actual lab testing. Because of a technical issue, the data that was entered was unable to be shared. The result was that 46 Lancaster County residents waited 7 or more days for their test results. But the problem that prevented some individuals in the local health departments from receiving lab results appears to be rectified. The state has assured us that no tests were lost and all data was entered into the system correctly. We would really like to see test results coming back within 24 hours, but overall turnaround time for receiving our test results has been improving. Over the past 3 weeks, 80% of all testing results were received within 3 days. Our nurses have been able to complete 94% of the investigations within 24 hours, so contact tracing is on target. The capacity of Lincoln hospitals has been healthy, and the number of COVID patients has been trending down since the beginning of August. But this week we have seen the number of hospitalized COVID patients increase from 15 on Sunday, August 23rd, to 26 patients reported today. 8 are Lancaster County residents and 18 are from other communities. Over the last 2 weeks, we have seen the overall number of hospitalizations in Lincoln increase, and the ICU bed capacity has dipped below 50%. This hasn't happened since late May. Again, the position of our risk dial is determined by 3 weeks' worth of data on these multiple indicators. The map shows how these metrics were averaged and why the dial returned to the orange or high-risk area today. Toward the bottom left, testing availability and contact tracing are near green. Toward the middle, you will find average daily hospitalizations, ICU bed availability, and the case rate per 1,000 in the middle near the yellow and orange border. Toward the upper right, the metrics associated with new cases, connected cases through investigations, average testing turnaround time, and weekly positivity rate are in the orange. And finally, you will find the location of the risk dial represented by the blue square outlined in the red in the middle of the gradient map, just inside the low orange section. Until we have a vaccine for COVID-19, we all must focus on protecting ourselves and others with simple common sense principles such as wearing masks, washing our hands, and staying at least 6 feet away from others. If these measures are not taken, the virus will continue to impact our community medically, financially, socially, and psychologically. Let's be part of the solution.
Thank you, Director Lopez, and I want to thank our health team and our educational community for continuing to work very closely together to identify cases, complete investigations, implement contact tracing, and prevent further spread among other students and into our larger community. Still, as Director Lopez mentioned, we continue to be concerned, of course, with students contracting the virus outside of the classroom and the impact that that could have on our wider community. To all the students who are providing leadership on campus to protect your classmates, yourselves, your teachers, and faculty and staff, and to protect the chances of you being able to stay on campus for the school year, I say thank you. You are vital to our success in this effort, and with your help and your willingness to get tested, to wear masks, to wash your hands, and to keep that physical distance from one another, I know it's hard, but if you continue to do that, we will all have a better chance of existing in a way that is more familiar to keeping campuses open and for you to enjoy a school year despite the challenges. Plus, if we are successful together, we could show the rest of the country how this is done. The University of Nebraska is an incredible partner to our city team and to our health department and to all of you on campus. They're taking the risk of COVID-19 very seriously, and today we are honored to have UNL Chancellor Ronnie Green here with us to share more about the efforts being made to support the educational success and the health of our community.
Well, thank you very much, Mayor. It's a pleasure to be here today, and I just want to start by thanking you for your leadership in general, but in particular these last 5 months as we have faced COVID-19 as a challenge in our community and globally, as well as Director Lopez, who we have been working with hand in hand throughout the lead up to our return to campus here this past week, and we appreciate that partnership very, very much. As the Mayor and Director Lopez have referenced, the University of Nebraska came back into session for this fall initially on August the 17th with a week of remote instruction as our students returned to Lincoln from all over the world where they come from to study with us this fall. We began in-person instruction on our campuses on Monday of this week, so we are just finishing as we speak our first full week of in-person instruction across the University of Nebraska-Lincoln. We began our planning for return to campus in late April and began in earnest planning and thinking about how we could lead nationally and bringing students back into the in-person environment that we think is so important educationally for them. And the amount of effort and planning that has gone into that arrival in today, our operations, has been monumental. And I can't thank our faculty and our staff across our campus enough for that planning that has enabled us to begin this instruction. As the mayor mentioned, we have put public health first in every respect in the way that we have thought about our fall operations at the university, including de-densification of the campus, adherence to social distancing, of course, application of personal protective equipment, facial coverings in all instances on our campuses, and limitation of group gatherings, yet still trying to continue those operations. So that has worked, and it has worked very well in our first operations this past week. We also have set up testing availability for all in our community, both through an on-site in partnership with Test Nebraska on campus that began on August the 12th for scheduled testing, as well as through the University Health Center with Nebraska Medicine on our campus, in addition to the variety of ways that we know are available for testing. And we've encouraged that for our population to take advantage of. We did release yesterday for the first time our daily dashboard. You can find that at covid19.unl.edu, and you will find that dashboard that daily will update the results of tests. I see that on the screen here in front of me. That refers to the daily counts as well as the running totals since that August 12th inception. I also would join the mayor in saying to our students who we are depending on for success as we move forward, to continue to be diligent in practicing the protocols and the policies that we have in place. I have been out on campus routinely through this past week and have seen an increasing level as the week has occurred in confidence of application of those policies and procedures. So we are looking forward to a very successful semester ahead. We are in daily contact with the Lincoln and Lancaster County Health Department and Director Lopez and her team, and we'll continue to work hand in hand with them as we move forward. So thank you, Mayor. I appreciate the opportunity to be here. And even in this strangest of times, go Big Red.
Thank you so much, Chancellor. We really do appreciate the working relationship that our health team and our city has with the university and other institutions of higher education in our community. We are all in this together, and by working together, we can be greater than this virus. We do have a quick update for you today regarding the status of our local directed health measure, or DHM. Earlier this week, the governor's office announced that the Phase 3 directed health measures that are in effect until August 31st through the state will be extended through September 13th. We will be extending our current local DHM through September 30th. Our DHM mostly mirrors the state measure, and one of the differences, of course, is our local requirement for wearing face coverings or masks. And with our data moving us back into the high-risk level of our dial, with schools back in session, and with activities and events increasing in our broader community, we must remain committed and focused on our public health strategies that will help us continue to keep our community moving forward. Please continue to observe these proven successful practices of wearing face coverings or masks, washing your hands, watching your distance between yourself and others, and to avoid large gatherings as much as possible. This is how we will make it through together. In other news, we want to share with you that members of Nebraska Task Force 1 who were deployed to Texas for Hurricane Laura are on their way home. We look forward to their safe arrival tomorrow afternoon. And of those who were deployed to Louisiana, 2 Lincoln Fire and Rescue members and 1 member of the Omaha Fire Department will remain there now to continue their service in Louisiana as part of the incident support team. We are so proud of their contributions and their service. And with that, we'd like to open this briefing for questions from the media.
Mayor Riley Johnson with the Journal-Star.
Riley.
Question for you or the director, but with respect to the new DHM, obviously outside of the mask mandate, the current DHM has some capacity limits for the operations of businesses. Will those continue to kind of on through the end of September, or will they, will increased capacity or full capacity be allowed at those businesses that I think were somewhat limited, like restaurants and bars?
The step put in place in collaboration with other organizations and businesses will remain as part of the DHM as a way to try to continue to make forward progress and to keep people safe in our community. Any further questions?
Hi, Mayor. This is Jeff Robb with the Omaha World Herald. I have a question for the Chancellor, if I could.
You bet. Thanks for being with us, Jeff.
Yes.
Hi, Chancellor. Jeff Robb with the Omaha World Herald. I just wanted to ask you, when you see other colleges around the country struggling with the virus right now, why do you think UNL can be any different in its approach and achieve any better success?
So obviously, Jeff, we are following very carefully what is happening across the country on our colleagues' institutions and their campuses. We're keenly aware of institutions where there have been more challenges with caseloads that could not be controlled when they returned to their campuses and actions that have been taken. You're probably aware of several of those around the country. We do feel very confidently that the mechanisms that we have put in place to be able to contain and control transmission are working, and we're seeing that be the case. Most of the institutions where that has been an issue did not have some of those mechanisms in place that we do and that we feel very strongly about, including the contact tracing ability that we have, including the quarantining ability that we have, to be able to, as I call it, put our arms around any potential emerging cluster, as you know we've already done with a few of our Greek sorority houses. So we feel very confident in our policies and procedures, and as I say, you heard me say earlier, how our students are responding to those. We see them responding routinely.
Chancellor, if I could ask one other question.
Sure.
Are you comfortable with the level of testing that you're getting at with the university, and would you consider increasing that, or even testing all students perhaps?
Yes, very comfortable with the level of testing. We're following the guidance of both the local health authorities as well as the University of Nebraska Medical Center that have advised us throughout the process of our planning. And so the availability of that testing on an as-need basis, we think is the right approach and is the appropriate approach for us to follow. With that said, we are watching very carefully the testing environment, right? So there's tremendous growth occurring as we see in the kinds of tests that are becoming available. And as tests become available in a different way, we may change that stance, particularly on a surveillance basis, where we may look at a percentage of our population on a weekly basis that we use for surveillance. So does that make sense? So we are looking at it that way as well.
Yes, thank you.
I have a question for Director Lopez.
She'll be up in just a second, Riley, but I just wanted to back on the question that was asked of the chancellor and say that, you know, we're humble as we face this virus. We know that it is powerful, it is contagious, and one of the advantages we've had in Nebraska all along is the preview of events on the coasts. And I think that while our students are students and they love being social, and we completely understand that, I think we all have had the preview of what's happened. UNC sent students home. Notre Dame went to all remote classes for 2 weeks, and the future of that campus is still uncertain. I think our kids here in Nebraska know what's at stake. They've had a preview of what's at stake, and they want to stay in school. They want to stay on campus. It's a lot more fun to be on campus than to do remote learning from home. As a parent who just took her daughter to college, I can speak firsthand how determined my 18-year-old is to have a successful stay on campus. And it will just take each of them staying committed to these practices of washing hands, watching their distance, and wearing masks, and being willing to get tested. There's no shame in having a positive case. We want to help kids who are positive, help them stay in school, help them stay healthy. All they need to do is continue to seek care, encourage their housemates and their roommates to seek care. We will provide that care and do everything in our power to keep them on campus. We know that's going to help with their educational success. We know that helps our institutions. We want to be bigger than this virus, and we're counting on them to be a part of that success. Now I'll bring up Pat.
Good afternoon, Riley.
Good afternoon, Director. My question sort of piggybacks off the transmission risk. Obviously, we have more people, in the city, but a lot of that population, as you noted, is sort of highly active, but with each other. Is the risk for, Joe Q or Jane Q resident of Lincoln any different than it was a couple weeks ago if they're not going out to bars with the students and or they're not going to those places downtown that are frequented by those populations?
That's a really good question, and that's something we're really monitoring. Right now, we can see where our cases primarily are, and our community numbers are remaining suppressed about 20 per day, are a little bit about 22. So right now, that's one of the measures we're really watching closely. That's what we've been talking with the university about as we meet every day, about what we're looking at, what's happening in our whole universe, not just on campus, but how is this impacting the progress we've made as a community as a whole.
And then a follow-up, just because I'm kind of a little bit confused, but with the DHM that will go into place next, does it effectively change anything from the current DHM?
No, it's
Okay,
just,
so
it's a continuation of the current DHM. So there'll be no changes, so everything remains the same.
And how do you what do you want people to know if they've read earlier in the week that we're going to be relaxing in, mid-September statewide? I mean, are you worried at all about having, the state opening up further as, we sort of remain in this stage?
We aren't concerned about that because we've had very minor differences with some of the other DHM, and the people in our community have risen to that, and that's why we are where we are right now. And we, from our experience, expect that to continue. And the other thing, Riley, is it's been reported that there probably will be a change, but there has been no change announced. And as you know, in watching this, things can change from day to day in what we're looking at in our environment. And I just have to say, I just met with all of our school superintendents in Lincoln and Lancaster County, and they're they are very supportive of remaining in phase 3 to give the schools really time to get deeply rooted and established in this process and see what's happening. So, a couple more weeks of looking at that, giving us another 30 days to have school in at least 6 weeks, and looking where we're at, we can really make good decisions together.
And another public health related question, but when does the county, when will you start looking at sort of the other concerns with flu risk and the interplay between influenza and this virus? And when will that start reaching your radar?
Well, actually, we're already doing that. And we do surveillance. We're doing flu surveillance. We're doing COVID surveillance. And we have a committee made up of our local providers. And we're going to be meeting the second week in September and really going through some recommendations as a community. We're working jointly with CHI, St. Elizabeth, and Bryan, and with the Lancaster County Medical Society to get messaging out about influenza testing. So we'll be able to update you more on a lot of the things that we've already put in place.
And just another follow-up on that, Riley, we spoke in a previous briefing, I think it was last week, about encouraging our community members to make their plans now to get a flu vaccine. It is so important this fall to try to ward off what some have called a twindemic of, flu season plus COVID-19. The good news is some of the preliminary research and data from the Southern Hemisphere, where they've already been through winter, is that flu rate is down, and we think that that is largely attributed to the fact that more people are washing their hands and wearing masks and keeping a distance, that these preventative practices for COVID-19 also have benefits in preventing the flu. And that, of course, is so important, not only for people's health, but also for protecting the capacity of our healthcare system. We want to make sure that we have the availability for patients going into fall and winter. So again, make your plan to get a flu shot now. The flu vaccine will become available in the fall, and we want to see as many people vaccinated by the end of October as possible. Again, our local health team is working with their vaccine plans, not only for COVID-19, but also for the flu. We want to make sure that we have available supply that can meet the demand of the community. And again, we encourage everyone, get a flu shot this fall. Any other questions?
Riley with the Journal Star. A follow-up question. Is there any difference between the cases being reported from the Greek system organizations to the university and that being reported to the health department? Are they being reported to both places?
I'll let Lopez come up and answer questions about that process.
Riley, can you repeat that?
Yes. Is there any difference in the COVID-19 case reporting among the Greek organizations on campus at UNL to the university? And also, are they being reported both to the university and to the health department? Are our numbers inclusive of all those cases?
The health department is providing those numbers for the university and the Greek houses. So all the data is coming from the health department because that's the central location where all the data is reported. So I'm glad you asked that question to make it clear so everybody understands that data isn't coming from university administration or from the Greek houses. It's all the same data that we report in the community, processed the same way.
The numbers of this is just a pandemic question, but a self-reported positive case is not actually captured in the total. Is that correct? Only lab reported cases get
Correct.
counted in the total.
Right, and we have we have never shared self-reported cases because you really need that validation of the test result to establish a case, or you can create a huge margin of error, and that could really do a lot of damage to the work that we're trying to do to move forward.
Catholic cases, even though they're on the UNL dashboard, those numbers came from.
Yeah, the cases on the UN dashboard are entirely from the health department. That is not any data that UNL collects. That's all from the health department in our secured area that comes from. Nobody has access to that except the approved individuals. So that's where that's from. And, Riley, I think you asked before about the students, and I will say, a lot of the students several of them do work in the community or in other areas. So we continue to monitor that in our contact tracing to see, but we haven't seen any spread related to that. So I just wanted to give you a little fuller answer about that.
Director Lopez, if I could ask a question.
Sure.
This is Jeff Robb with the World Herald again. Can you tell me who is in the makeup of the people who are being hospitalized this week, and are any of those in that 11 to 29 age group?
I can't say that for sure, but I'm not aware of any in the 11 to 29 age group. I know that we've taken community members from other areas, part of our surrounding communities, either due to some staffing issues at long-term care or needs for more complex care than could be provided in some of the hospitals surrounding us. But Jeff, I'll take a look at that and I can get back to you.
Thank you.
Sure.
Any further questions from the media? All right. Well, thank you so much for tuning in. We appreciate your close attention to issues related to this pandemic. We appreciate all that our community members are doing to help prevent the spread of COVID-19. Please have a safe and healthy weekend. Thank you.